Good morning, everyone. We're going to go ahead and get started this morning. Welcome to the presentation today. My name is Cindy Kenna, and I'm going to be your moderator today. We have an excellent presentation planned for you today, navigating the Medicare maze and what you need to know for 2027, led by Brent Smedley. And this is his wife, Ellen. Before we get started, I wanted to give you a sense of what the Wise Aging series is all about. The Lincoln Hills Foundation created this program to help residents navigate the many changes that come with growing older. Not just the obvious ones, but the quieter shifts that build over time. Wise Aging is designed to help you anticipate those changes, understand what they mean, and feel more prepared long before a crisis forces decisions. Each month, we'll focus on different aspects of aging, cognitive and physical changes, medical and financial planning, daily life adjustments, and the social and emotional transitions that affect us all. Our goal is to offer clear information, practical guidance, and tools that you can use to make thoughtful plans and maintain control over your choices as life evolves. As you came in today, our volunteers gave you 3 documents. The first one was a comment card, and we're hoping that you will provide comments to us of what you would like to see in the future for planned presentations. So we have 5 categories. If there's a specific one, write it in of something that you specifically would like to learn about. On the back of the card is also some information on the foundation itself. We also gave you a small slip of paper so you can add your email to it if you'd like, and receive notices of upcoming presentations and a link to the video recordings for each session. Email is the best way to be sure that you receive an update. If you miss our advertising, you'll have the personal invite in your email to tell you when the event is. The third item you have is a flyer that details out our next 2 presentations, and I'll talk a little bit more about that in a minute, but we hope you'll attend those 2 presentations. We are videotaping this presentation today, and the recording will be available on our website. At the end of the presentation, you can drop off your comment cards and email slips in the baskets located right outside the doors. A little bit of housekeeping. We have emergency exits here and over here, and 2 in the back. And we ask that you silence your cell phones and any other devices that may interrupt the presentation. Restrooms are through the back doors and to your right. And then a little bit on the next 2 presentations. The first one is Cognitive Aging, which is going to be happening in September. And the second one is Know Your Health, Plan for What May Be Ahead in October. Both these presentations are going to be led by Marcia Van Wagner, a very well-known and highly respected Sun City Lincoln Hills resident who brings deep knowledge, clarity, and genuine passion for topics of aging. She's an outstanding presenter with a gift for making complex information understandable and meaningful for all of us. So please don't miss those next 2 presentations too. So now let's get on to today's presentation, Navigating the Medical Maze, What You Need to Know for 2027. We all know that Medicare can feel like navigating an unpredictable maze with no clear path forward. With Medicare open enrollment for 2027 beginning in October 15th, today's presentation comes at the perfect time to learn how Medicare works, when and how to sign up, how to compare your plan options. Our speaker, Brent Smedley, will walk us through the pros and cons of different types of plans, what to consider when choosing coverage, the changes coming to Medicare. He'll also look at the broader landscape of Medicare and what future shifts may mean to us as older adults. His goal is to help us better understand, to ask better questions, compare options with confidence, and plan ahead with clear information. We are fortunate to have Brent with us today to help guide us through the complicated Medicare maze. Brent and his wife, Ellen, are a Lincoln-based husband and wife team who leads Smedley Insurance Solutions and are deeply rooted in family and community. Inspired by helping their own parents navigate Medicare, they founded their business to provide honest, personalized guidance to individuals and families. Since then, they've helped thousands of people understand Medicare, health and life insurance, retirement planning, and 401k rollovers. As independent brokers, they lead with education, careful careful listening, and a commitment to treating every client like family. They have built strong, lifelong relationships grounded in trust, integrity, and exceptional service. After Brent's presentation today, you'll have an opportunity to ask questions during our Q&A session. Please raise your hand, and one of our volunteers will bring a microphone around so everyone will be able to hear the questions. And with that, please join me in welcoming Brent Smedley as our presenter today, and his wife, Ellen. Thank you.
Okay, very good. Thank you very much. Can you hear me okay? All right, fantastic. Yes, you can. Okay, very good, very good. Well, we're excited to be here with you today. Thank you for coming out, and we're just hopeful that you'll get a lot of good information and share it with those others who maybe are not here with us today, that you might be able to impart some good information with them. Again, I'll talk a little bit about us, and we're just excited to be here today. So let's get into it, okay? Okay, so today we're going to cover a couple different topics. I guess before we get started, I do want to get a show of hands of who's here and what you have. Is that okay? Who's on Medicare? Okay, who's not on Medicare? All right, okay, fantastic. Yeah, that is a hand. You're not on Medicare yet? Okay, I just need to know. Okay, and who has a Medicare supplement plan? Okay, who has a Medicare Advantage plan? Who doesn't know? Me. Yeah. Okay, very good. Who has CalPERS? Veterans. Any veterans here with us? Thank you. Thank you for your service. Okay, veterans. Any TRICARE for life? A couple people. Okay, very good. It's fantastic. How about Kaiser? Anybody going to Kaiser? A couple people. Sutter. Okay, UC Davis. All right, okay, that gives me an idea. Thank you very much for raising your hands. Helps me understand our audience and who we're speaking to. So that's great. Thank you so much. Today we're going to talk about a little bit of the state of Medicare, what's happening, and get you some updates. Hopefully that's why you're here. We're going to talk about some of the Medicare basics for some of you that are brand new, getting ready to Medicare. It's a new word for you. We're going to talk about supplement plans, advantage plans. What's the difference? How do they work? We're going to talk about prescription drug plans, and then what do we see coming up in 2027? Does that sound fair? That's why you're here, right? Okay, all right, very good. Well, first off, as you met my wife and I, we're the founders of Smedley Insurance Solutions. We're based right here in Lincoln. We've been raising our kids. We've raised our kids here in the area, and we love it. My mother moved here about 8 years ago and loves Sun City. I think she was over at the pool this morning already, so... and this is just a little bit about us. So we are the proud parents of 6 children. Anybody have 6 children? Yeah, we're crazy, but we love it. There ranges from 26 down to 13. We have a pair of twins in there as well. So, in fact, one of them just got married. We got our first child get married this summer, so we're super excited about that. And we have another one that's getting... He just graduated from college or high school, and he's sending off to Dominican Republic to serve a mission. So he's going to be gone for a couple of years. So we're excited for him and what his journey is going to tell. A little background. I was speaking with Cindy a little bit. So out of college, I started working at an auto auction. Okay, and I was a commercial account manager. So I worked with Ford and General Motors and Hertz and all these different companies. And I had the privilege of managing a big portfolio of cars that were running through the auto auction. Anybody been to an auto auction before? Yeah, okay, very good. So, and I picked up the trade of being an auctioneer, so that's kind of fun too. Anybody been to an auction? I can get a $25 here, get a $50 where, get a $75, you get a $100 where, get a $100 here, get a $200, go. All right, so I've sold thousands of cars as an auctioneer. And coincidentally, though, we've been able to use, we love being an auctioneer because we actually found a lot of different foundations that we've been able to help raise money for them and help them in their nonprofit organizations raising money for good causes. Has anybody heard of Silver Wishes? A couple of people. I just have to share with you. About 5 years ago, I met Stephanie Berger. She's the CEO of Silver Wishes, a nonprofit organization. And they are similar to Make-A-Wish Foundation, but they grant one-time wishes for seniors. Isn't that neat? So they grant one-time wishes for seniors. They've put roofs on people's homes. They've fixed walkways. They've put AC units in. They've given a Christmas tree. They've done all kinds of things to help people get a new recliner if they needed one, just all kinds of things. And so we're a big part of their foundation, good ambassadors for them. And so I use my auctioneer skills to help raise money at their fundraising events. And so it's just a joy to be able to be a part of them. As mentioned, we got started as we were helping our own folks. My father passed away, and I quickly found my mother moved here into Lincoln, and she started having stacks of paper on her counter. Anybody have stacks of mail on the counter? Yeah, that was my stack of paper. So when I came over to visit with her, it was like, here's all the papers. What do I do with all this, right? So we found that quickly we learned that man, there's so much information, and seniors are a targeted market of people that have so much information, and we feel that they get just a little bit vulnerable. And so we found a great way. First off, we started helping our mother figure out some things, and we said, hey, we can help you save some money on your Medicare plan. And so we quickly learned that. And then we also learned that we can help people with Medicare, and we don't ever have to charge a dime. So we don't have to be salespeople, because we hate being salespeople, right? We want to be educators. And so that's the heart of what we do, is educating people about Medicare. And so we've been able to help thousands of people and talk to lots of people about Medicare and help them navigate them and answer questions for them. So that's what we love doing. We help people with life insurance and all kinds of other good things. So that's just a little bit about us, okay? We do have lots of Google reviews. You can check us out. Google Smedley Insurance Solutions. We have all kinds of Google reviews. We're voted best of the best in Lincoln, Chamber of Commerce for insurance companies, Citrus Heights as well. I grew up in Citrus Heights. That's where I come from. So very good. Well, let's get into this. So the state of Medicare. So we know about the crazy marketing advertisements. Well, it's just around the corner. And for those that you're turning 65 or getting ready for Medicare, you're probably becoming pretty popular right now. But we're just about September, October, all the stuff's going to start coming, the phone calls, the emails, the text messages, the mail that's coming in. Well, unfortunately, that does happen. That's kind of like a gift for turning 65 and getting onto Medicare, right? As people are interested in you. So that doesn't go away. But we do hope that some of that, again, a couple of things that I always tell people is two things. Medicare will never call you, okay? So Medicare is never going to call you. So those phone calls, if you don't know who it is, don't answer it, okay? Social Security, they're never going to call you, okay? They'll never call you. Unless you set up an appointment with them, they're never going to call you. They'll send mail to you, but they'll never call you, okay? So don't answer the phone if you're not sure who it is, okay? Please don't. And then there are a lot of pieces in the mail. You get lots of mail, and it looks like it's government material, okay? It's very confusing. They're very good at deceiving us. Well, for our customers, we take a picture, send it to us. We look at it, we say, that's trash, throw it away. Yeah, no, you do need to pay that bill, or you do need to do this or that. So we try to be an advocate to help all of our customers, help them navigate these. Again, that stack of paper that I was talking about that my mom gets, so she's learned how to get through some of it. But if you're not sure, ask somebody, a trusted advisor, okay? Good thing, call centers. I want to tell you a little bit, some updates. Call centers. The insurance companies are finding out that there's these major, they've known this, but these major Medicare call centers are calling and badgering all these seniors. Well, they're learning that it's creating bad agents, and it's creating bad business. So the insurance companies are terminating a lot of these bad call centers. How about a clap for that, right? Yeah, that's like, thank you. I can't tell you it's going to you're going to still get it, okay? But hopefully we've seen some of these major big call centers that they sound very reputable and they sound very trusted. They're massive, and again, they're just deceitful a little bit, and so we're excited about that. So they're cracking down on that. The other positive thing is good agents is good news. There are very good Medicare broker agents, such as ourselves, we like to say, that are out there helping people do good things. Does anybody have a Medicare broker? Anybody worked with one in the past? No? Yeah, maybe? Okay. So there are good Medicare brokers, just like a good financial planner. Okay, we like to have a good auto or home insurance broker in our pocket. We like to have somebody like that. Well, there are Medicare brokers, and that's what we've chosen to do, is be licensed insurance brokers to help people specifically with Medicare because there's such a need. So we just specifically deal in Medicare, okay? And there's never a cost to you ever. So if you use our services or another agent, there's never a cost to you. They should never charge you. And there's no upcharge. If you help if you find a plan that you like to get and they help you get the plan, there's no extra cost for using them, okay? So why not use somebody, right? Medicare funding. So let's talk about Medicare funding for a minute. So we have supplement plans and we have advantage plans. Well, about 7 or 8 years ago, the government started putting more money into insurance companies to fund Medicare Advantage plans. And so that's where we saw a big rise in Medicare Advantage plans. That's where we saw a big rise in a lot of the free benefits that come from Medicare Advantage plans, food cards and all these extra dental, vision, hearing, all these different things. And so we saw a big rise in that. And so, and a lot of marketing and advertisement trying to get people hooked on something that looked free, okay? So that happened. Well, that stopped about 2 years ago. So we're seeing a little bit of a decline, and at least in that major marketing of those services. Medicare Advantage plans are still very good plans, but we're seeing that happening. So, and we're currently in today's market, we're seeing about 50% of people are on Medicare supplement plans, 50% of people are on Medicare Advantage plans. Okay, so that's kind of what the makeup looks like now. Also, supplement plans. So we read and follow, last year, the government was going to try to reduce doctors' pay by 3%. So if you worked in your profession for 20, 25 years or more, and somebody came along and said, actually, we're going to reduce your salary, your pay, would you like that? No. So luckily, so some people got involved and helped try to correct that so they didn't decrease the pay for somebody who was on original Medicare to a doctor, right? We need good doctors, right? We're already in a shortage of doctors. So luckily they were able to reverse that. They didn't give them an increase, pay increase, but they at least kept it stable, okay? There's a lot of disruptions. We've had the most disruption in the Medicare space in 25 years. In the last 2 or 3 years, we've had the most disruption ever. And that's due to a lot of the drug plans, a lot of the funding and so forth. We've had over 6 million people across the country, their Medicare plans have been terminated, okay, meaning that the plans were terminated and they had to find a new plan. Was anybody on the United Healthcare plan last year? Was Sutter? And it got terminated? Do you remember that maybe? Yeah. So over 15,000 people in the greater Sacramento area had to find a new Medicare plan, okay? So we worked with our customers who were on the plan. We knew ahead of time. We knew what was going on. So we approached it at the very beginning to help our customers find a new plan that would still fit their doctors, their medications, and everything they're dealing with. So anyway, so it's nice to have somebody to help you kind of navigate that. Medicare utilization, what is that? Well, after COVID, what happened? A lot of surgeries, lots of procedures began to happen. People were going out and getting all these different things they needed to have done. And so health insurance saw a spike in the utilization or in claims for health insurance needs. And so that's created, for the insurance companies, they've had to really navigate that, and all of a sudden they're paying out more claims than they're getting money coming in. And so they've had to increase their pricing on their plans in order to stay abreast, okay, in order to stay afloat. And so we've seen a huge increase. In fact, we've had on the supplement side, we've had 3 major insurance companies leave the California market just because they just say we can't make any money on it at this point. So again, we help our customers kind of navigate that and help make sure they're taken care of. Also, with that, we're seeing on the Medicare Advantage plan, we're seeing less Medicare benefits, extra benefits. So all the extra benefits, there's the gym membership. I told you about the food card, over-the-counter benefits, dental, vision, and hearing. A lot of the insurance companies are starting to scale back all those extra frilly benefits and just specifically focus on the health insurance, the medical side of the business. Lastly, Northern California, It's kind of considered the toughest market in the country. So a group of United Healthcare regional representatives all have been on meetings all the time. And anytime they talk to the representatives in Northern California, all of them are like, oh, I'm sorry. You're in a bad market. It's a tough market. And so luckily, we're here for you to help you kind of navigate that, help you figure that out. We help you answer questions, help make sure that things are being taken care of for you. All right, let's move along. Okay, let's talk about the Part D updates. I want to give you a little bit of information on Part D updates. The Inflation Reduction Act made some major improvements to Medicare Part D. A couple things. Remember the donut hole? Okay, it's gone, right? Donut hole's gone. They also reduced the catastrophic level or coverage that somebody would have to pay out for Medicare prescriptions. If you were taking expensive prescriptions, Eliquis and albuterol, Jardiance, and all these different medications, well, they reduced it so that people only have, currently this year, it's a $2,100 maximum out of pocket, okay? So they were able to reduce that, okay, with the Inflation Reduction Act. Part of also the Inflation Reduction Act, they were able to negotiate drug pricing. So the government's now negotiating some of the drug pricing to try to help drop prices down. Temporary financial assistance program. So I got asked this question here this morning. Has anybody seen in the news, they said Medicare Part D is going away? Have you seen that in the news? Okay, maybe. Okay, well, the media is kind of falsifying the information. It's not true. Medicare Part D is not going away. What happened was there was a stay or a financial assistance program that was helping stabilize with the new changes in the drug plans. The insurance companies were saying, hey, we can't afford this, we can't do this. So the government came in and said, all right, we're going to help you, and we're going to fund you some money to help you stabilize this new act, this new drug program that they enacted. So that's the funding that's going away at the end of this year. Okay, so we do anticipate some insurance companies raising their drug premiums because they might not have that financial assistance anymore. But they've also had an opportunity to try to stabilize and see what's going on in the market with their drugs. Premium protection. This is an important point. There's 6%. Insurance companies can only, on specifically drug plans, they can only increase their premiums up to 6%. Okay, so that's nice. At least there's a cap. But we have seen a lot of drug prices go from $5, they're now $50, or from $50 to $100, and from $100 to $150 on the drug plans. I did mention negotiated drugs. So in 2027, the government is currently right now negotiating prescription drugs. You can see a couple of them up on the screen: Ozempic, Wegovy, Trilogy, Breo, Janumet, and many others. So they're negotiating some of the pricing on those drugs to help reduce those costs. All right, let's move along. And then you have also the maximum out of pocket for 2027 is going to be $2,400. And the maximum drug deductible is $700. This year it's $615. It's going up to $700. We want to encourage and remind you that every year during the annual enrollment period, you need to review your drug plan to make sure it's the right drug plan for you, okay? Because these plans do change year after year. Let me get to this one. Okay, anybody heard about the GLP program? Yeah, no, maybe? So just real quickly, the GLP Bridge program. This is a program out there that some people have asked about. It's a program that the government's trying out to see if they can help seniors with weight management. So they're trying to make the GLP-1 drugs accessible to seniors so that they can get onto a GLP-1 if they choose to. They have to qualify. They have to meet the criteria for it, okay? So on the BMI, they have to qualify for it, and if they do, then they can get on it. The cost of it's about $50 a month, and they're checking it out to see if it's going to help seniors be healthier, help reduce medical costs overall, and so forth. So that's a program that's out there right now. If you're interested in it, go see your primary care doctor. The GLP-1 program does not affect your Medicare plan. It's a separate program funded by the government currently till 2027. Or through 2027. Okay, for those that are, now we're going to move on. Those who are on to looking at Original Medicare. Here's how you get ready for Original Medicare and signing up for it, okay? So scenario one, if you're currently receiving Social Security, you're going to receive your card automatically. Number two, if you're not receiving Social Security, We're going to talk about what you need to do there. And number 3, if you're still working and you're covered on your employer plan. So let's just briefly go over those for our individuals that are looking at Medicare. Original Medicare, if you're currently receiving it, you're going to receive your ID card about 3 months before your birthday month, okay? That's when you're going to get it. And they're going to start taking out $202.90 for Part B, Social Security, all right, out of your Social Security check. If you are not and you are ready to sign up for Medicare A and B, you can do that. Social Security is the gatekeeper to your money and to Medicare. They're 2 different applications. Okay, so if you want to just apply for Medicare, you can do that. You can do that by following the link that I have up there on the page. We can send you more information about this. You can call, set up an appointment to visit, do a phone appointment, or have an appointment in a Social Security office, and so forth. They also do, if you're not going to draw Social Security, they do bill you quarterly for your Medicare. Okay, so that's important to know. And again, we can send you information about a quick single one-page handout that tells you exactly how to apply for Medicare. And if you're currently working and you have an insurance plan from your employer, well, this is an important time for you to determine and discuss with somebody like ourselves, hey, should I stay on my employer plan or should I get on to Medicare? Okay, that's an important piece. We help you evaluate the costs between Medicare and your employer plan. And also there's a couple important rules regarding if you should, in fact, apply for Medicare. A lot of people can be penalized if they're over the age of 65 when they get onto Medicare, or if they do not get onto Medicare and they miss the window of opportunity. So we go over, discuss that. All right, next up, and also your Medicare, original Medicare will start on the first day of your birthday month, okay? Okay, this is a handout you should have that we gave you. So right here, this is our little cheat sheet to Medicare, understanding the Medicare plans and how it works. So go ahead and turn to that page. This will be very valuable today. So again, Medicare Part A and B comes from, this is because you paid in the Medicare tax throughout the years. And so this is the insurance that you're getting from the government. The government says you get Part A and you get Part B right there in the middle of the page. Part A is your hospital coverage. It's $0. You don't have to pay anything for Part A. But the coverage you get from just having Medicare Part A is if I go to the hospital and it's a $100,000 bill, I'm going to pay $1,736 for the deductible. And everything else is covered under Part A. Okay? Part B is your outpatient Medicare services. That costs $202.90, all right? Now, what do you get with that coverage? Well, Medicare pays 80% of the bill. Any outpatient services, so doctors, labs, MRIs, ER visits, x-rays, an outpatient surgery, cancer, radiation treatment, all of that falls under Part B of Medicare. It pays 80%, and you're left with paying 20% of the bill. Okay, so we don't like the 20%. That's a pretty steep number, right? So we need to get something to help us, all right? So that's what original Medicare covers, is just the thing, the stuff at the very top. You have the deductible to pay, and you have 20% to pay. So now you have an option. You get to pick a supplement Medigap plan, or you get to pick a Medicare Advantage plan. And we're going to talk a little bit more about that. But before we do that, Part B of Medicare also has an IRMA. Has anybody heard of IRMA? I see a couple heads shaking. This is the current IRMA schedule. Okay, so this is the current IRMA schedule, so you can look and see where you stand on your taxes. Okay, and so the government's going to look at it and say, all right, Mrs. Jones, your taxes in 2024, your adjusted gross, your monthly adjusted gross amount was so much. And so if I'm a single individual, the first bracket says $109,000 or less. If I pay $109,000 or less, I go over to the right, it says my Part B costs $202. But if I made $230,000, I'm all the way down to the bottom there almost, and I'm going to pay $649.20 for Part B, Medicare. And then I'm going to pay an additional $83 for the Part D drug plan because of my income. Okay? Wow. So anyways, this is an important chart. This always goes back 2 years. There's always a 2-year look back, okay? And we try to help people evaluate how to avoid paying this additional cost. Sometimes there's some life-changing events that we can adjust this, to help you avoid paying some of these additional IRMA costs. All right. Now, let's talk about the two options of Medicare. We've got the supplement plan and the Advantage plans. Again, the Medicare supplement plan, I like to consider it the Cadillac insurance policy, okay? It's the premier insurance policy, if you will, okay? And let's look at the left-hand side here on the bottom. So a supplement Medigap plan offered by private insurance companies, there's Plan F, there's Plan G, there's Plan N, a lot of different plans. Well, most of these plans are going to give you about 100% coverage of original Medicare. What does that mean? Well, that means that your supplement plan is going to pay the $1,736, and it's going to pay the 20% of Part B Medicare. All right, now we like that, right? So that means you can kind of go in and out of the doctor's offices without worrying about having to pay copays or what it might cost you. Okay, so that's one of the benefits of having a Medicare supplement plan. There's also no provider network. It is the greatest PPO plan there is. What does that mean? That means you can go to UC Davis, you can go to Stanford, you can go to UC San Francisco, you could go to the Mayo Clinic, you could go find a doctor. If they take original Medicare, you could go see them. Okay, that's the idea behind a supplement Medigap plan. Now the cost, excuse me. Now, and there's no prior authorizations. Now I say that with an asterisk because the prior authorizations you'll typically see even within the medical groups here that we work with today, they still seem to have a step process of approving what you might need to get done, okay? And so that's why in California, these supplement plans they don't quite work exactly like they work all around the rest of the country because the medical groups here in California control more of what's going on, okay? There is, on a couple of these supplement plans, an annual deductible of $283 this year. Every year that number goes up. Last year it was $274. The year before it was $264. So it'll go up. It'll be close to $300. We don't know what that number is yet. And also on a supplement plan, you need to get a Part D drug plan, okay, a separate drug plan. So if you're going to go with the supplement plan, you're going to have original Medicare as your primary insurance. It's going to pay 80% of the bill. You're going to have a supplement plan that's your secondary insurance, and you're going to have a third drug plan, okay, a separate drug plan. You're going to have 3 different cards, okay? Now, these supplement plans, let me give you some pricing just to give you an idea. A 65-year-old right now on a Plan G is paying about $200 a month. A 75-year-old on a supplement Plan G is paying about $300 a month, okay? So these supplement plans, they raise, the premiums go up every year as you get older. Why? Because you're probably going to use the service at some point a little bit more, right? Okay, so they got to increase their premiums because they know that the life expectancy changes. And so that happens, okay? And also what you probably, some of you, anybody on the AARP supplement plans, United Healthcare AARP supplement, how about Anthem Blue Cross supplement plan? Yeah, okay, so these different plans, every year they come out and they give you an annual rate increase, okay? Not only on your birthday does it go up as you get older, but they also come out and it's almost like auto or home insurance. They just say, hey, we're raising our rates. Okay, unfortunately, we're seeing rates going up quite a bit, okay? 15% rate increases right now on the supplement plans. All right, so let's turn to this. So this is the supplement coverage of a Plan F, G, or N. Some people say, well, I got the Plan F, it covers everything. Well, that's right. Well, a Plan G covers everything, 100% coverage, except for the Part B deductible. How much is the Part B deductible? $283. Thank you very much. Okay, and I could get a Plan N, covers everything but the Part B deductible, $283. And there is some excess charges that you may be charged if a doctor wants to charge you more than what Medicare pays them. Okay, so we're going to go over that here in a second. So let's go to the next page. So this is what a Plan G looks like right now. So again, the premiums are $200 to $350. Medicare Part B it costs you $203, and then you have to pay the deductible. The Plan N says you have to pay the $283 deductible. You do have up to a $20 copay to doctor visits, and a $50 copay to the ER. Okay, so that's the difference in Plan N. Well, why would you consider, if I'm on a Plan F, why would I consider a Plan G, or why would I consider a Plan N? Well, maybe because those 15% rate increases are just too much, and I still want to have access to a PPO network of doctors, and so maybe I'll go down to a Plan G because it might cost less money, and I'll still be able to have access to all my doctors and the coverage that I need. Okay, so as the prices are going up, we try to see if we can get a little bit lower. Okay, so that's kind of why I just wanted to share that with you. What's that? That's right. So generally if you leave Plan F, okay, or it's F, G, N. So if you leave Plan F, you can't go back to it, right? If you leave Plan G, you go to N. You can go back to it. You just have to be healthy. Yeah, so you do have to you have to be healthy to go back to it, okay? So, but again, as we navigate our budget, we navigate what's going on, we may say, "Oh my gosh," and I'll just tell you this. I'll touch base. I'll tell you this now. So again, some people, what we've been able to do though is even on the Plan F. So the Plan F plan with, let's say, United Healthcare, and the Plan F with Anthem, and the Plan F with Aetna, it's the same plan. So what's the most important to you? The premium cost, right? So what's most important to me? The premium cost for you. So we want to always find the best premium priced plan for you, right? That's what we want to do. And because remember, if I start at a premium of $300 and Joe starts at a premium of $250, so over the year, well, mine's going to go higher, and Joe's is going to go higher too, but at a lower rate going up, right? So we always want to shop those rates and make sure you're on the right Plan F. Yes, I got a question in the back. Do we have a mic for her? She had a very anxious question. We're going to do questions at the end, but if there's a pressing question you want to ask me, I'm okay with it. Let's do it.
When you were just talking about the supplement plans,
yeah,
you mentioned age-based pricing. There's also something called community-based pricing, and I did a bit of research on this when we were doing it, and I know AARP United Healthcare also has community-based pricing, so your pricing is not based on your age.
So in California it is. So in California it is. So in each of the different states, so they do that in different parts of the country. They do have community-based pricing. We have not seen any community-based pricing in California.
I have that insurance.
Oh.
I went to a broker like you.
Okay.
And it's an AARP United Healthcare Plan G.
And does the premium go up every year?
Well, premiums go up, but it's not based on your age, like what you mentioned.
Okay, so
Which I know about what you're talking about, but there is other plans that do community-based pricing.
yeah, okay, very good. Well, and we can talk about that if you'd like to. So again, I think it's the same thing that we're talking about. Again, your prices of your supplement plan are going to go up as you get older. Again, there's attained age and there's community-based pricing that are out there for supplement type plans. So yes, there are some of them out there. And we work with all of AARP United Healthcare plans, Anthem, Aetna, Blue Shield, Blue Cross, all the different plans that are available out in the market. So any broker that, such as myself or another one out on the street, is going to have the same access that I have to, or anybody has to, the plans that are available. So thank you. Okay, so let's go. I want to get to this slide right here. This is also in your handout right here. Okay, so I think it's the third or fourth page in there. Okay, so this is just a recap of supplement plans. Okay, so remember, when you're on a supplement plan, you do need to get a drug plan, and you do need to review your drug plan every year, October 15th to December 7th, to see if it's the right drug plan. You don't change your supplement plan during the AEP, or the October 15th to December 7th, okay? We'll talk about that in a second. California area, as I was mentioning, I said California's a tough market, a tough area. Well, why is that? Because the medical groups here act like HMOs a lot. And so they do have some, again, as I was mentioning earlier, if I want to get a procedure through Sutter or whoever it might be, they still have kind of their steps to get an approval from, to say, yeah, that's okay, Joe can get this service or what have you it is. So that's just there, and they want to get a referral, okay? They usually want to have a referral. They don't want you self-diagnosing yourself and going into calling up a cardiologist and say, hey, I want to come see you. And this, I'm speaking in generalities. I can't just call up a cardiologist and say, hey, I want to come see you, have original Medicare. Oftentimes they want to say, well, who's already seen you, right? Have you seen a primary care doctor first to make sure that there's a reason they're seeing you, right? So that's kind of typically what we see. I did mention high claims and utilization. Again, insurance companies are paying out 85% of the money, the premiums they get from you, are paying out in claims. 10% of it is going to operating costs. So that's where a large percentage of their money is going. I've talked about carriers leaving the market. Rate increases, I talked about that as well. 10 to 20% rate increases just a flat across the board on your pricing of your plans. There are some plans that offer household discounts. So if you and your spouse or your significant other are on with the same insurance company, you can get 7 to 12% discount monthly off of your premium. And then lastly, talking about the California birthday rule. Who knows about the California birthday rule? Yeah, a couple people. California birthday rule says for your supplement plan on your birthday between 30 and 60 days, you have the opportunity to shop your supplement plan and see if you can get a better rated supplement plan. Okay, so again, examples, plan F to plan F. I can change from Joe's, from United Healthcare plan F to a Aetna plan F. If the Aetna plan F is cheaper, I can do that on my birthday, no questions asked, okay? No health questions asked. Yeah, that's right. So that's why we say, hey, we always show, so we've helped, so examples, you know, I helped a couple, they were paying about $350 a piece for their supplement plans. I said, hey, let's check on your birthday, let's give me a call. So we talked to them on their birthday. I said, oh, we could find this for about $275. Does that sound good? Yeah, okay, $275 for you, $275 for you on your birthday. Well, now you guys are saving over $150 a month on their premium for their plan, right? That's a huge saving. And that's not only just this year, so that's $1,800 in a yearly savings. But if you do that year after year, that compounds to a lot of savings and money if you get onto a lower rated plan. If I can drop my rate down lower, then I'm going to trajectorily go up at a lower rate as well. So you could save a lot of money. And then again, as I mentioned, sometimes some people say, hey, you know what? I just can't afford this anymore. I need it. I have all these doctors. I just can't afford it. So we say, well, let's get you from maybe a plan F to a plan G. You could still go to all your specialist doctors, or going from a G to an N and make it a little more affordable for them. And so we look at those options as well. Okay? All right, let's carry on. Let's talk about Medicare Advantage plans, okay? So now we're going to go back to this chart, okay? You can go back here, go back to this one here that I have in the handout. Let's talk about Medicare Advantage plans. What are Medicare Advantage plans? Well, Medicare Advantage plans, they take, it's just like an employer plan. It takes the A, B, and D of Medicare usually and puts it into one Medicare plan, okay? And they call them Medicare Advantage plans or Part C plans. Usually these plans are networks of doctors, okay? These plans are networks of doctors, and the insurance company is a part of this. We have HMO Advantage plans and we have PPO Advantage plans. Well, a lot of PPO Advantage plans are leaving the market. Why? Because it's too expensive for them. So we're seeing an exodus of PPO of Medicare Advantage plans. We've got only maybe one or two here in Greater Sacramento, where we used to have quite a bit more. So we're seeing them exiting the market. With Advantage plans, you do have prior authorizations, okay? So you have, you know, if you need a surgery, they're going to make sure that, that you get approval for it. Copay, so you have some minimal copays along the way. I'll give you an example. You're familiar with it. Maybe a $5 copay to your doctor and a $20 copay to your specialist. Maybe $100 for the ER visit. A hospital stay might be $200 a night for up to 5 nights. Okay, so those are kind of what the copays look like. Urgent care, $0. an MRI might cost you $50 to $125. So those are kind of what the copays look like on an Advantage plan. You're familiar with that, those who are on them. They also have maximum out-of-pockets, which this is your medical side of the plan. So it says, we've seen plans from $2,000 in our area up to $7,000 in maximum out-of-pocket, which basically says if you pay all these copays along the way throughout the year and you reach the $5,000 maximum out-of-pocket, then you pay no more the rest of the year. Now, most of the time, people don't ever hit the maximum out-of-pocket. Why? Because they're just going to get, the copays are pretty low. So the only time you typically hit a maximum out-of-pocket is if you go into a skilled nursing facility, okay, or you get cancer and you go through radiation. Those are the two bigger things that we see that people hit it. Otherwise, people don't hit the maximum out-of-pocket, and they're just paying their copays along the way. Now, these plans also include some dental, vision, and hearing, and if you want the honest truth or my opinion about it, most of these Advantage plans, the vision is okay. The dental, it's no good, okay? The dental on these plans is really, they're very limited. There's maybe one or two plans that have a decent dental plan, but most of the time they're, I'm just being honest, that's probably one of the phone calls we get the most from our customers is, hey, I need to get dental. We say, wait, remember, we talked about the dental. I said, it's not very good dental insurance, right? Because again, what are the insurance companies doing? They're going back to just being more of a medical insurance provider, and they're not putting it, they want to be able to say they offer dental because everybody else says they offer dental, but it's not very good, okay? And just a quick note on that, you can get a dental policy for about $50 a month for about $2,000 to $2,500 in dental coverage per year. Okay, so that's a separate dental policy that we can help you get. Hearing, some of the plans will offer up hearing aids, which actually is pretty good. Some of it works out pretty good. They have reduced copays. Maybe you pay $300 to $800 per hearing aid. So they have reduced copays on the hearing aids. And some of them are offering those extra benefits that we were talking about, a gym membership, over-the-counter card to spend at CVS or Costco or Walmart. Some of them are offering up, they try to say they offer up help pay your utility bill or paying for gas. Sometimes they're trying to say that. Very few people can get those. In Placer County, we don't really have many plans that offer that at all. Or you also have to be on Medi-Cal to get those type of benefits, okay? I didn't talk about Medi-Cal. I should have talked about that at the very beginning. Medi-Cal, let me real briefly. Medi-Cal is health insurance for low-income individuals. It's typically based off of your income. So a single individual making less than about $1,700 a month would qualify for Medi-Cal. And they can have Medi-Cal and they can have Medicare, okay? And then all of their medical services are covered. They don't pay, okay? But they kind of are restricted as to where they can go to the doctor. And we work with a lot of folks on Medi-Cal, Medicare, a lot of different people that maybe aren't living here or maybe living in mobile home parks or different areas. We have a lot of folks that we help out because we want to help them get the right services. Okay, so let's talk about this for a second. So these Medicare Advantage plans, this is a chart in your handout as well. So this is the best way that I've tried to help explain how these Medicare Advantage plans work, okay? So you can see at the top we have the insurance companies. We have all these different carriers, United Healthcare, Alignment, Scan, Aetna, Kaiser. You guys have heard of some of these, right? Okay? So what happens is you can see some of the lines. So let's just follow United Healthcare. United Healthcare's blue line goes to Hill Physician. Has anybody heard of Hill Physician? Yeah? Okay. Hill Physician Doctors, a group of independent physician doctors. Well, United Healthcare went to Hill Physician and said, let's make a contract. Let's make a deal. We want to have a plan. So they created a Medicare Advantage plan, HMO plan, that goes to Hill Physician Doctors. So that means you can go to all Hill Physician Doctors on this United Healthcare plan, okay? Well, United Healthcare last year had a line going to Sutter. Okay, and so United Healthcare had a contract with Sutter, and so if I went to Sutter, I could be on United Healthcare Advantage plan. I'm not talking about the supplement plan. I'm talking about the Advantage plan. That I could go to all Sutter doctors under United Healthcare. Well, that was the plan with 15,000 people on it. That was terminated at the end of the year last year. So all those people had to find a different plan that went to Sutter. Well, so you could see Alignment has a plan that goes to Sutter. You can see Scan. You maybe heard of Scan. They're new to the area. They have a plan that goes to Sutter doctors, okay? And you can kind of follow these lines. So this is what happens, and this happens year after year. These things kind of change, or they can change based on the contract that the insurance company creates with the medical group, okay? And if I start going to this, if I'm with, let's say I'm on the scan or the alignment plan going to Sutter, well, now I'm in an HMO plan, and I can go to all Sutter doctors, and that's who I can go to, okay? Does that make sense? Now, these Advantage plans are very good, right? Again, so what is good about Advantage plans? Well, the Advantage plans, let me go back here. These Advantage plans on the far right, the premiums on them, a lot of them are $0, or they're maybe $18 or $19 at Sutter. So they're very inexpensive. So if I'm on an Advantage plan, I'm going to pay $202.90, and then I'm going to pay maybe $0 or maybe $20 for the Advantage plan per month. That's my cost, okay? And hey, I go to all Sutter doctors. I have a cardiologist. I have a urologist, and I like their system, let's say. Well, then the Advantage plan might work for you because you're already going to all those doctors, okay? We also have Kaiser, right? There was a couple people who had Kaiser. Kaiser has their own insurance policy that goes to Kaiser doctors, right? Okay? So that's kind of Advantage plans there. Let's go through this. So this is kind of just a basics, just kind of a recap. This is also in here in your handout. So this is kind of a recap real quickly on the Advantage plans. Okay, they have star ratings. You want to look at the star ratings, 0 to 0 to 5, okay, are the star ratings. Just to remember, a lot of carriers are pulling out of the markets. We're seeing a lot of disruption in the market right now. So working with the trusted Medicare advisors will help you make sure that your plan's working well. They're going back to the basics, Medicare insurance policies for insurance, not all the extra benefits. These plans are also, this chart that I showed you is based off of Placer, Sacramento County. So if I move to a different county, well, my plan, it can be different. Okay, they're going to be different plans. When you talk to your sister down in L.A., she's all, oh, well, I pay nothing for nothing and nothing, and I get all these extra benefits, right? Well, that's because she's in L.A. and there's different plans in L.A., right? And my friend, my uncle who's in Texas said, oh, well, we got this PPO plan and we got da-da-da-da-da-da-da. Well, that's because he's in Texas, okay? So remember, these plans are generated based off of where you live, okay? That's important. Because people say, oh, no, your sister says you got to sign up with United Healthcare or whatever it is. Well, maybe the United Healthcare doesn't work with in our area. Just depends. HMO plans and networks. The ANOC, this is what I want to talk briefly about is an ANOC. What's an ANOC? The annual notice of change. So if I'm on an Advantage plan or a drug plan, in September, October, I'm going to get a letter, either email or a mail from my insurance company that's going to say, hey, Mrs. Jones, your plan is changing, and here's how we're changing the plan. The copay from $5 is now going to be $10. The copay for the ER going from $100 is going to be now $125. Okay, they're going to change the copays a little bit, so pay attention to your ANOC letter, okay? And we go over that with all of our customers. We review that and tell them everything that's happening so they know exactly what's going on. The annual enrollment period is October 15th to December 7th. That's when you can change your Medicare plan, okay? There's also what a lot of people don't know about is called the open enrollment period, which is January through March. Okay, let's say I got onto a plan in October. It starts in January. I go try out this new plan, and I don't like it. Well, January through March, I can change my plan one time. Okay, so let's say I wanted to switch from Sutter to Hill Physician or from Kaiser to Sutter or whatever. If I want to change my plan, I can do that, and I can check it out and try it out, and if I don't like it, I can change January through March one time, okay? Or then I have to wait till the next annual enrollment period, and I can switch back, okay? So we help people kind of do that. And there's also special enrollment periods. Hey, Brent, what happens if I move to Texas? If I move in July to Texas, well, I can change my plan. Okay, I have an open enrollment period to change my plan when I move. All right. Okay, let's move along. Our Part D process. So Part D, we've got, we help input the drugs the medications you might be taking into our online calculators. We look at the pharmacy that you like to go to or the preferred pharmacy. We compare all the different Medicare drug plans that are available to you, and then we help you enroll into the plan that makes sense for you. And this needs to be reevaluated year after year. Now, for our customers, we help them do this drug plan review. Because unfortunately, a lot of the insurance companies are no longer paying insurance company carrier or agents like us to help you with your drug plan. They're no longer paying us any commission. So if I spent 30 or an hour with you trying to help you look at your drug plan, and I'm not going to get any commission, would you keep doing that every day? Probably not, right? But with somebody who is a customer of ours that we're helping them navigate it, then we do. If we're helping them with their supplement plan, then we help them look at their drug plan as well. All right, veterans. We had a couple veterans in here. Real briefly, if you have TRICARE for Life, okay, that is a supplement plan. So that is like it acts just like a supplement PPO plan. That's essentially what it is. You don't pay for it though. Okay, you just have to have Medicare A and B, and you have a PPO plan. You go wherever you want to. Period. End of story. Okay. There are Medicare Advantage plans for people who are veterans that go to the VA. And if they go to the VA and they like it, they can get $140 rebate back on their Medicare or for their Medicare Part B costs of $202. So that's something that we help veterans navigate with. We do seminars at the VA and so forth down in Mather, and we talk about how we can help veterans with their Medicare and their VA programs. They can get second opinions if they have a Medicare Advantage plan. If they're not happy with the service they're getting from the VA, they can go outside of the VA with their Medicare Advantage plan and get a second opinion. Okay, real quick, so wrapping it up here, myths about, I must have to pay a fee to use a broker. Again, we charge no fees ever for our services. Nobody works for free. You must charge a higher price. No, there's no higher price. If we help you with a plan or you figured out to do it yourself, there's no extra charge working for us, so it's a win-win for you, win-win for us. We can help you, and you can get the expertise and all the help that you need navigating Medicare year after year. And then also, are we swayed by one insurance company or another? No, we're an independent broker, which means we work with all the major carriers in the area so that we can make sure that we're offering you the best plan. Why would I put you on a plan that I don't think is the right plan for you, right? So we believe in doing the right thing for our customers, whatever that is. Okay. A little bit extra. Again, we have a service department. We provide expert guidance on plan usage. We help people deal with their claims, billing issues. Hey, I got this bill. Do I pay it? What does this mean? Is anybody tired of seeing all the different bills you get from Medicare and your insurance company? And it's really confusing. So we help people navigate all that, right? We're here to help answer those questions. We know doctors. We know doctors that are taking new patients. Anybody ever have a problem like, I can't find a new doctor? Yeah, well, we visit doctors' offices, and so we know who's taking new patients in the area, okay? So we visit them. We know these doctors in the area, so we help provide that service with people. Again, remember, we also help with special enrollment periods. If you're moving, we can help you find a new plan. And you get a peace of mind working with somebody who knows what they're doing. All right, let's recap here. We're here to the end here. So again, the biggest updates on Medicare. We've had the biggest changes to Medicare last 25 years. A lot is going on, so stay updated on what's going on. Remember, supplement rates are increasing, so we can help you with the California birthday rule. Could help you save some money on your supplement plans. And make sure that you do a drug review in the fall during AEP. Medicare Advantage plans, you're getting less extra benefits, all those little frilly extra benefits. And we're seeing a reduction in the PPO plans. The annual enrollment period is October 15th to December 7th. You'll know it because, boy, all the TV ads will just be running nonstop. Anybody see the Humana ad? You've seen the Humana ad? Humana ad goes out. It's really funny because they market across the country. There's no Humana Medicare Advantage plans in Sacramento. And they run for minutes. I go to people, we visit people in their homes, and we sit there and they're watching the TV, and there's a Humana ad running, It's like going for minutes on minutes. It's like, oh my gosh. So anyways, you're going to start seeing those, you're going to start seeing the ads. Again, just make sure you're working with a trusted Medicare broker, somebody who can help you. If it's not us, make sure you're working with somebody else, okay? They can't hurt you. More than likely, if they're trusted, they can help you. Make sure they have, a good following and people are happy with their service, right? So that they're providing a good service. And do a Medicare annual review. Just like a financial review, if you're doing a financial review with your financial planner, you should do a Medicare review with a Medicare broker every year or every other year, okay? And we can help you, okay? And so we're happy to help you do that. All right, with that being said, do we have any questions? Oh my gosh, all right, I like it. Okay, we got a couple right over here. We'll start right here on to my right. Yeah, here we go, this couple here, yeah.
We recently moved from Contra Costa County to Placer County.
Nice.
And we are in a Medicare with a supplement,
Yeah.
Plan F. And so we received a little bit of a benefit. But what I'm up against is trying to find a primary care physician that accepts Medicare within the Sutter Health Plan.
Yes, okay. So that's a great question. So again, remember as I told you, supplement plans are PPO plans, right? Well, Sutter, if I'm not with Sutter and I move into the area and I want to go to Sutter, Sutter says, you have to be on an Advantage plan. Okay? So again, this is an example of how the medical groups in California are controlling what is going on instead of the insurance being the insurance. Okay, that's a prime example of what's happening. So we work with people. We know other doctors that are Sutter independent doctors that we can help you get into a Sutter independent doctor, which kind of gets you the back door into all the Sutter services.
As my primary care physician, and it's really a process because to get the transfer, the referrals to
from- yeah,
specialists here.
Yeah.
I mean, it's working it, and I'm just,
Yeah.
it's very,
Yeah.
hard.
That's super challenging. Yeah, you bet. Well, welcome to Placer County, though. You're in a great place. And welcome to Sun City. This is a great place. Again, 11,000 seniors here. So much activities, lots of things to do. If you have individual questions specific to you, at the very end here, you can. My wife will be in the back. We have a little thing. You could fill out a little thing, contact information. We'll be happy to set up a quick appointment with you, a brief call over the phone, maybe answer some of your questions, and get some specific details of how we can maybe help you. So again, we're going to have those out here in the back as you're going out today. If you like, you could just fill out the card, and we'll be able to set up a brief call. It doesn't cost you anything. We're going to try to help you navigate some of your questions that you might have personally. Yeah. Oh, your birthday, you're saying, too. Okay. All right. Very good. Yeah, so we'd be happy to visit with you. Okay?
One cautionary tale on Plan F, you can't get it anymore. You can only grandfather in until you make a change, because once you make the change, you cannot go back.
Yes, that's right. Yep, that's right.
It's a great plan. We've been on it for 10 years at least, but the problem is for those that would like it, unfortunately, it's not their available.
Yeah. If you're not on a Plan F and you want to get a Plan F, yeah, you can't get a Plan F. And if you're new to Medicare, my friends that are new to Medicare, you can't get a Plan F because they stopped offering it to people after 2020.
Right,
So you
doing
get Plan
Plan
G.
G.
So we
Right.
can help you navigate the
Okay.
Plan G. That's right. Okay, great question. I had another question over here, I think. Oh, over here. Yeah, go ahead.
We'll do you next, okay?
Go ahead. Oh, let's get that. Go ahead. I'll repeat her question. Pre-existing conditions, yeah?
Changing plan for changing companies and so forth?
Great question. So let me go back to this slide here. Let me go back to this one right here. Yeah, this one right here. Okay, so that's a great question. I forgot to mention that. So if I'm on a supplement plan, okay, if I'm on the left-hand side, I'm in. Okay, I'm always can be on a supplement plan, F, G, or N, or whatever it is. Okay, I'm already in. Medicare, what's that? Medicare Advantage plans always accept you. Okay, Medicare Advantage plans always accept you no matter what. They can't ask any pre-existing condition questions, okay? So, for my folks that are getting new to Medicare, if I'm on an Advantage plan now and I want to go to a supplement plan, I have to go through the medical underwriting questions to get approved on a supplement plan. Let's say I'm not happy with my Advantage plan. I now have to go through medical underwriting to get into that, okay? Now, all those 15,000 people that lost their Sutter plan with United Healthcare last year, there's some other rules, and I don't want to bore you because I'm over my time, but there's some other rules. Well, those people, we were able to actually help them get onto supplement plans without any questions, because there's some specific rules if their plan exit the market that they can get on a supplement plan. It's a little window that gets them in. So it's amazing. So again, we know a lot of little different secrets and rules and tricks to help people get to that. Okay, so that's one thing that's an important piece there. And then if I'm new to Medicare, so I always tell folks, again, we're unbiased to the plans, but I just want you to understand, when you first get onto Medicare, for those that are looking at it, when you first get onto Medicare, when I first get onto Medicare at 65 or 67 when I retire, they have to accept me on a supplement plan regardless of my health history. Okay, so that's usually the time to get in on a supplement plan if you want to get in on a supplement plan, because they have to accept you. Okay, so that was another important rule that I forgot to mention there. So thank you. Good question. Yep, so if I go from an Advantage plan to Original Medicare, I'm going to restate her question. So if I go from an Advantage plan to Original Medicare, I can do that, but then I'm susceptible to the 20% that I'd have to pay for all of Part B unless I get a supplement plan. Okay, so that puts me at a high risk, right? So I could go to Original Medicare, which would give me access to different doctors if I want to get out of the Advantage plan, but then I'm susceptible to the 20% and the 1736. Okay, that's kind of hard. That's right, because if the supplement plan doesn't accept you. Yep, that's right. Okay, another question right here?
Yeah, hi, I'm just curious. It seems as though you're giving a lot of valuable advice to people. Who pays you since you're not charging us?
Oh yeah, I thought I explained that in the beginning. I apologize.
Maybe you did.
So I apologize. So as insurance brokers, just like an auto or home insurance broker, okay, how do they get paid? They get paid from the insurance company. Okay, so the same thing for us. We get paid from the insurance companies if we help you with an insurance plan. Yeah, so we're never charging you. Yeah, I apologize. I thought I said that at the very beginning. Yeah, we get paid by the insurance companies, so we are able to help you navigate everything. If we help you get onto an insurance plan, great. And if we find that we can't help you, we're going to tell you, hey, you're on the right plan. Stay there. Okay, we're going to tell you that. That's just how we work. I'm an Eagle Scout. I believe in doing the right thing. So we're always it's true. I was raised that way. We do the right thing. We're not gonna try to sell you something because we think we want to make some money. We want you to do the right thing. We're going to treat you just like our family. We said that at the very beginning, and that is our word. Okay.
You mentioned some challenges of going from an Advantage plan to a supplement. Do those challenges exist if I'm going from one Advantage plan to another Advantage plan?
Yeah, that's a great question. No, you're always accepted. So, case in point, well, I won't say, but so I've taken several people from, let's say, Kaiser over to Sutter Advantage Plan, okay, or from Sutter to maybe they want to go back to Kaiser or they want to go somewhere else. They can do that. No problems, okay, that you can do that year after year. That's what the annual enrollment period is for. Yep, great question. Okay.
Wait for the mic.
Maybe you can help me out. There are people that have Medicare and they have like a union benefit supplement plan.
Yes.
And it's not like it's with a health insurance, it's through their union. How does that all work? I don't understand it.
Yes, that's a good question. I'm sorry. That's why I was kind of trying to pull the audience here. So there are, so again, like if I'm a state employee and I have a CalPERS, okay? If you worked for the state, not the county, but the state, and I worked there for 20 years, well, they have a great retirement program. And they have Medicare plans offered to those that have CalPERS. I don't have access to that. The only way you can get that is through your employer, going to CalPERS. Okay, if I work for HP or Intel, these large companies, sometimes they've brought people in years ago and said, hey, we got retirement plans for you and all this stuff. Well, what they do is they go out and they negotiate, or a union goes out and negotiates with United Healthcare or Kaiser, with these different companies, and they create group Medicare plans. They're called group Medicare plans. Well, those are not plans that you and I can get unless I'm part of that group. Unless I worked for the union or unless I worked for HP, I can't get it, okay? A good question. And then we do this often. People are getting ready to retire. They say, hey, my employer's offering a retirement program for me. And they say, hey, my employer's offering this great retirement program for me. I say, okay, fantastic. I said, let's just take a look at it, okay? If you can give me some information about the plan, let's compare that to what's out on the marketplace. And if your employer plan is better, we're going to tell you to stay with the employer plan. And if we see that the marketplace that we can help you get is better, we're going to say, maybe, we're not going to tell you what to do first off, but we're going to say, look at this. You might have a better option, because the group plan we're seeing a lot of these group plans starting to raise their premiums a lot too. And so we've helped people come off of these group plans because it's getting expensive. The group plans are also having to deal with price increases and claims and utilization, and so the prices of their plans are going up too. So sometimes it's beneficial for them to go out and get a different plan on the marketplace. But we're going to help them do the right thing. We're going to always tell them what's right. So that's right. Very good question. Okay, any other questions? Okay, so lastly, again, if you'd like some help from us, this is a simple little form we have on the back on the table there. Pick one up from my wife. If you just fill out some basic information, all this says is you're not signing up for anything. All this says in the fine print, so we're all compliant, just says that you agree to talk to us about Medicare. We're never going to, we're not selling anything without your, we're just trying to help you. If you'd like to ask some questions, fill it out, and then we'll reach out to you and set up a quick appointment, a little quick call with you just to kind of go over some things and see if there's a reason that we can help you or not. Okay? Very good. Well, thank you very much. Was this helpful? Okay. Please tell your friends and family about us. Okay? We've got cards out there. We've got some giveaway stuff out there too. And then if you want to scan this, he took it off the screen. Can you put that back up, Peter? My last slide. Could you put that last slide back up for me? Yeah, so if you like what we've done today, whether you talk to us ever again or not, you could go ahead and scan this QR code. It will allow you to do a simple review for us on Google, okay? It just helps people find out that, hey, these guys are honest, reliable people. They provided a great seminar. We'd love it if you wouldn't mind giving us a review. Just scan that, and then we'd appreciate that as well. Thanks again so much for coming, okay? We hope to see you again soon.